Betty Jane and Bob Henry met at horse shows. He had gotten involved in horses as a pastime, and so they had that mutual interest above all others. I was very close to Lee. He was afflicted by hemophilia, and these were the days before clotting factors, so he would have terrible hemorrhages. At one point, Lee had 99 whole blood transfusions in 1 month, just to keep him going. Most hemophiliac families didn't know each other. They were few and far between. They wanted to find out what it was, and they wanted to do research, and they needed some sort of support. So Bob Henry and Betty Jane decided to form a foundation, and Bob Henry was a lawyer and a certified public accountant, and in a file drawer in the back of his office, Hemophilia Foundation was founded. And it was their idea to found chapters, to spread beyond Manhattan, the metropolitan chapter. And now the foundation is available to anybody with a blood disease. The research and the work done in the 65 years is absolutely amazing.
Our organization is the first chapter of the National Hemophilia Foundation. We were founded 1 year after the incorporation of the National Hemophilia Foundation. A group of 6 to 8 families formed an organizing committee to come together and raise awareness of hemophilia for their own sons. And they quickly recognized the benefit of working together and knowing other people with hemophilia, and took that further and started doing regular educational programming throughout the Chicagoland community, including the suburbs. And they developed a very solid organization that was doing blood drives for their children, because at that time that was the only type of treatment that was available, was whole blood transfusions. And they raised a ton of awareness through those blood drives and got more recognition about hemophilia. To watch the families work together and support each other and share that knowledge, and sometimes just there for a hug. We all need a hug, but boy, to get a hug of understanding from someone who has gone through the exact same thing. That's one of the greatest things that our founding families did, and we continue to do today, is you don't have to be isolated with hemophilia.
NHF currently has a record number of 51 chapters, and in addition to that, we are working with individuals in a couple of underserved states with the potential of building new chapters. Through the different divisions of the Chapter Services Department, we work with local chapters in chapter development, education programs, and state public policy. A lot of what NHF has done over the last several years has been based around the ACT initiative, which stands for Access to Care Today, Achieving a Cure Tomorrow. The 5 pillars of ACT are government awareness and support, education for all life stages, access to HTCs and beyond, research and training, and strong local organizations. In order for chapters to positively impact the other 4, strong local organizations were a must. And that's where our emphasis has been.
Comprehensive care is very important for the care of individuals with bleeding disorders because in the past, so many of their issues were not recognized and addressed when they were being cared for by a variety of individuals in the community who either lacked experience or weren't communicating with each other. So with the advent of comprehensive care, this team of specialists was able to communicate not only with each other, but with the other consultants, and the entire patient was looked at, and all the patient's needs were identified and addressed.
Most of the time, hemophilia was such a problem that had so many problems involved and so many services needed that we thought we had to be the place that they could come. and not send them off to other agencies to get a piece of this and a piece of that. We had to be the central service.
Mary was a pioneer in her time when she put together resources and people to help people with bleeding disorders that didn't exist before she pulled the different components together. She was working in the late 1940s with a nurse named Dorothy White. They were working at Rochester General Hospital. Dorothy White saw a young boy named Chip Golem. He was the first patient with hemophilia that Mary Gooley had ever seen. And it was that little boy's mother who got together with Dorothy White. And the discussion that they had the first night that Chip came in, it was really the genesis of what became the chapter. And in 1959, that by then chapter turned to Mary Gooley and said, "Can you start us a treatment center?" Nobody said to Mary, "No, you can't." So she went ahead and she started a treatment center.
The plans were there, the patients were there, they needed some place to come, they needed a laboratory that knew what they were talking about to diagnose them, and we were beginning to have all of these pieces to put together, and we had fabulous staff. We had dedicated staff who wanted to do this. We didn't just hire somebody who had a degree in this and that and the other thing. They came to us and say, "Please find a place for us so we can deliver this to you." It was a wonderful time. It was a wonderful time.
Judith Graham Poole's discovery of cryoprecipitate really began the new era of treatment for hemophilia and other bleeding disorders. Prior to her discovery of cryoprecipitate, the only way that physicians could treat patients with bleeding disorders was with the transfusion of fresh frozen plasma or whole blood.
What Judith Graham Poole discovered was that if you froze plasma and then thawed it at 4 degrees, and you threw away the liquid, almost all the factor VIII and, interestingly, the von Willebrand factor remained behind in that precipitate so that you could refreeze it. It then became, for the first time, possible to treat patients with very high levels of factor VIII and von Willebrand factor replacement, and really led to our striving to have various concentrates to treat not only hemophilia A, but hemophilia B, and this showed the effectiveness of that approach.
Basic science is absolutely critical to improving the care of all diseases.
MASAC is the Medical and Scientific Advisory Council of NHF, and it's really meant to provide guidance not only at the clinical level, but also at the research level. The Judith Graham Poole Awards that are given by NHF are critically important to bring in quality scientists into our field. And what it did was to reward basic scientists, not necessarily always clinicians, but people that are involved in the laboratory study of bleeding disorders, and in this case, hemophilia.
There's very little direct support for somebody who is particularly interested in hemophilia and bleeding disorders. And I was lucky early on to get this grant support to stay in the laboratory. This allowed me to be able to say, no, there's important questions here that need to be answered. I see these families, I see these people with hemophilia in the clinic, and I'm sure that we can advance the care here. And so it allowed me to stay in that area, and here I am 20 years later, still able to, I think, ask and try to answer the interesting questions.
NHF provides a framework for leadership. We have a lot of passionate providers, physicians, clinicians who work hard for these patients. We have a lot of advocates who have fallen in like or love with this community. We have a lot of industry people who have dedicated much of their careers to this patient community. And NHF provides that leadership framework, a
place for people to contribute their skills, their knowledge, their passion that impacts patients and their families in a very positive way.
Congratulations to the National Hemophilia Foundation for your legacy and leadership, and for 65 years of moving the hemophilia community forward. We at Pfizer understand the impact hemophilia can have on patients and caregivers, and we're committed to addressing their needs by discovering, developing, and delivering innovative treatments and programs. As a proud partner of the NHF, together we've been able to help improve patient care through advancements in education, access, and opportunity. We look forward to continuing our partnership and to making further strides with our partners in keeping the community moving forward.